Next on the agenda, we have House File 520. Representative Morrison, would you like to move to re-refer House File 520 to the Health, Finance, and Policy Committee?
That is my motion, Mr. Chair.
Okay, thank you, Representative Morrison. Representative Morrison has moved the bill, and just to reiterate what I said at the first bill, there is an amendment to this bill as well. It is mostly a technical amendment, but it did not meet the 24-hour deadline. It is viewable on our website. We will not be adopting it because it did not meet the deadline, but it will likely be attached at a future date. So this would be a good opportunity to ask questions about it if anybody has any. So Representative Morrison, would you like to describe your bill?
Thank you, Chair Freiberg and members. I am pleased to bring to the committee House File 520, a bill that will protect and expand access to contraception in Minnesota. Birth control is essential to the health and well-being of Minnesotans. Nearly 9 in 10 women of reproductive age will use birth control at some point in their lives. Many of them for reasons beyond planning a pregnancy, such as treating endometriosis or migraines. Birth control allows women to plan and space their pregnancies, reduces maternal mortality, and unlike most developed countries, the maternal mortality rate, as we just discussed in the United States, is increasing. And Black women are most at risk of dying during or from childbirth. According to a Johns Hopkins study, increasing contraceptive access is one of the most effective ways to reduce maternal mortality. To ensure that Minnesotans can plan their families and their futures by accessing the birth control method that is right for them, regardless of cost and free of unnecessary insurance barriers, House File 520 does two things. Number one, it puts the Affordable Care Act requirement that insurance plans cover FDA-approved categories of contraception at no out-of-pocket cost into our state law. And number two, it allows Minnesotans to receive up to a 12-month supply of birth control at a time, covered by insurance. 16 states have already codified the ACA birth control rule into their state law and require their state regulated health insurance plans to cover a full range of birth control at no cost. 20 states have enacted laws that allow patients to receive an extended supply of birth control at once. With the ACA again before the United States Supreme Court, now is the time to pass this bill and make sure that Minnesotans can retain this important health coverage. Birth control is basic preventive health care. Millions of Minnesotans, including thousands of your constituents, members of our families, and many of us in the room today, rely on birth control to plan and space our pregnancies, control underlying health conditions, attend college, progress in our jobs. I urge you to join me in supporting this common sense bill that will help protect and expand access to contraception in Minnesota. Thank you, Mr. Chair.
Thank you, Representative Morrison. I have two people who have signed up. First, I have Dr. Martin Flynn.
Thank you, Representative Morrison and members of the committee. My name is...
Please proceed.
My name is Dr. Martin Flynn, and I am a member of the Minnesota section of the American College of Obstetricians and Gynecologists, and our college strongly supports House File 520. I would like to share a story about a patient, a story that is common enough to respect her privacy and illustrates that this legislation guaranteeing accessible and affordable contraception translates to positive impacts for Minnesota women. This patient sought care in the emergency department for nausea and vomiting of early pregnancy that had escalated to the point of her needing IV fluids to stay hydrated. While helping to plan a strategy to mitigate her symptoms, I asked how she was feeling about being pregnant. She expressed her pregnancy was difficult and not planned. Then she showed me a picture of her adorable 6-month-old baby. This patient had multiple barriers interfering with her planning the right timing of her next pregnancy. It is well established that planned pregnancies result in healthier pregnancies. We know accessible and affordable contraception improves health, well-being, and leads to economic gains. Accessible and affordable contraception reduces unintended pregnancy, reduces abortion, and reduces maternal mortality. As spoken about in the last testimony, we do face an ongoing crisis of rising maternal mortality, and the Minnesota Department of Health reports that during 2011 to 2017, that is an unequal burden in which non-Hispanic Black women had a 2.3 times higher rate of maternal mortality when compared to white women, and Indigenous women 4 times higher. Our own maternal mortality review committee in Minnesota, after reviewing the 2017 cases, gave one of the following recommendations to help prevent maternal mortality: assess all women for family planning and education on contraception. House File 520 addresses this recommendation and guarantees access to contraception, education, and counseling. We are at a critical moment. The US Supreme Court is deliberating a case about the Affordable Care Act that does have the potential to eliminate federal protection of access to contraception. This is a critical moment to pass state-level protections to ensure Minnesota health plans cover contraceptive services. With access to information, the right contraception, and the right timing of pregnancy, my patient, instead of showing pictures of her baby to the emergency department staff, could be home snuggling her baby. Thank you.
Thank you, Dr. Flynn. And I have one person who signed up for public testimony, Kia Whittier. Welcome to the committee. Please identify yourself for the record and proceed with your testimony.
Yes, thank you, Chair and members of the committee. My name is Kia Whittier. I am 25 years old, currently residing in Minneapolis, and a constituent in Minnesota House District 62B, represented by Aisha Gomez. And I'm testifying today in support of House File 520. After moving from St. Louis, Missouri to Minneapolis, I knew I needed to access birth control. As a young adult in college, I wanted to focus on my education and getting through university successfully. This meant taking one less potential worry away: getting pregnant. I made an appointment at Planned Parenthood and got set up with the birth control that was right for me at that time. I grew up in a single parent, low income household, so I feared that I'd be unable to afford any form of contraception, especially as a college student. But thankfully, my appointment didn't cost me a dime, which I am so incredibly thankful and grateful for. After some time, I began to notice some mild complications and ended up switching to the pill, which is something I still use today. So birth control has provided me with the protection my partner and I need, so we're in control of our lives and our futures as partners and as individuals. So the current law is that providers can only prescribe 3 months of birth control at a time rather than a full year's worth. In college, when I wasn't in class, studying, or doing homework, I was working. I was working a job that didn't allow for paid time off, which meant if I wanted to get my birth control pills, I'd have to make an appointment and lose out on pay every 3 months. Now, I'm employed full-time by an organization that provides paid time off, so accessing birth control isn't a current issue for me personally, but I know those within my community cannot say the same. I live in a working class area where many of my neighbors and community members don't have the privilege of being able to take paid time off work. And if they do take that unpaid time off, that impacts their ability to be able to provide for themselves and or their families. By passing House File 520, you're showing working class people that their time matters, that their lives matter. Increasing access from 3 months to 12 months ensures that people will be able to focus on the other parts of their lives for a longer period of time, thereby increasing access. As we know, and as it's been mentioned in this meeting already, access is a major issue in obtaining healthcare. So I implore you to pass House File 520 so we can ensure that Minnesotans across the state have the healthcare that they deserve. Thank you.
Thank you for your testimony, Ms. Whittier. Is there anybody else who would like to testify on this bill? Please raise your hand or speak up. Okay, seeing none, is there any member discussion? I don't have any hands raised at this point. I just saw a couple go up at the same time. Representative Heinzman.
Sure, thank you, Mr. Chair. Representative Morrison, just before I launch into a couple of questions, I just wanted to help people, myself specifically, understand a little bit. In your opening comments, I think I heard you say that birth control is a basic preventative health care need. Can you help me understand what that, in your mind, what that means? What are you saying?
Representative Morrison.
Thank you, Mr. Chair and Representative Heinzman. If I understand your question, contraception is basic to the well-being of people who are able to become pregnant. without being able to control their reproduction, they are unable to control their lives. So it is an essential part of preventive health.
Thank you. Representative Heinzman, follow up.
Thank you, Mr. Chair. I have a number of questions, and I guess I'm still drawing a little bit of a blank. You know, we hear about what preventative healthcare is in a lot of other contexts. I've never heard it used in this one. So that's why it caused me to want a clarification, and I'm not sure that I understand exactly what you're saying, but I do have some questions about how this would be rolled out. For example, if we had an individual that received a 12-month supply of a particular prescription and found, like, maybe, for example, the testifier actually mentioned that a change was needed. Would this legislation then cover the cost for an additional prescription? And would that lead to increased costs in this subject area? Or would there be language built into this bill that would prevent those kinds of things from occurring? How would that be handled?
Representative Morrison.
Mr. Chair and Representative Heinzman, if the patient and her provider deemed that a change was necessary, that would be covered.
Representative Heinzman.
Thank you, Mr. Chair. Yeah, that wasn't, maybe I ought to restate the question. I didn't hear an answer there, Representative. So the question is, if we had a prescription for a particular prescription was covered for 12 months, and then that changed, and you'd already had individuals that received that prescription, is there any language built into your bill that would prevent those increased costs from having those changes take place? You know, currently a 3-month supply, that's one thing, but if we're going 12 months, I'm just wondering if there's going to be any protection, any language in your bill that would prevent a sharp rising cost potentially in those kinds of scenarios.
Representative Morrison, I think you sort of answered it, but yeah, do you have
Actually, she didn't, Mr. Chair, so that's why I'm asking again.
Representative Morrison.
And Representative Heinzman, I guess I thought I did too, but that would be at the discretion of the provider. And I think that would be probably a more unusual circumstance.
Okay. Representative Heinzman.
Thank you, Mr. Chair. You know, I think that just my point is there's a concern that I have, and just wanted to see if there's any language here. And it doesn't appear that there is any kind of language in this bill that would prevent increased costs due to changes in prescriptions. So, you know, that's okay. I just wanted a clarification. I think there's a number of other questions, so I'll hang on to mine to the end if there's more time.
Thank you, Representative Heinzman. Representative Gruenhagen.
Oh, thank you, Mr. Chair. Yeah, thank you, Representative Morrison. Yeah, I have a couple of questions. I just have a summary here in front of me, but according to the summary, it covers, and just confirm this, contraceptive services covered under this bill is consultation, examination, procedures, and medical services related to the prevention of unintended pregnancy, voluntary sterilization procedures, patient education, counseling of contraceptives, and follow-up services related to the contraceptive methods or services, management of side effects, counseling for continued adherence, and device insertion or removal. So it's not just prescriptions. It looks like it's a whole host of other services. Am I understanding that correctly?
Representative Morrison.
Thank you, Mr. Chair and Representative Gruenhagen. It covers FDA-approved methods of contraception.
Representative Gruenhagen.
So Representative Morrison, would that include the list I read then?
Representative Morrison.
Mr. Chair, Representative Gruenhagen, yes.
Okay. Representative Gruenhagen.
Thank you, Representative Morrison. I have another question. Does this include coverage for abortifacients like Plan B, if I understand that, emergency contraception. My understanding is the supply requirement of 12 months is excluded, but the coverage for abortifacients are a coverage requirement. Representative Morrison.
Representative Morrison.
Mr. Chair, Representative Gruenhagen, this covers contraception, not abortion services. Contraception is not an abortifacient.
Representative Gruenhagen. Oh, thank you, Representative Gruenhagen, or Mr. Chair. But there are prescriptions that you can take that cause abortion early on in the pregnancy. So are they covered?
Representative Morrison.
Mr. Chair, Representative Gruenhagen, no.
Representative Gruenhagen.
Oh, thank you, Mr. Chair. The next question or comment I have, and you can respond. One of the things I've seen about mandates in general, but especially in healthcare, because I've sold health insurance for, since 1978, is that as soon as something is mandated, the price goes up exponentially. And then those who don't have insurance or access to insurance have a hard time affording that product because all of a sudden the producers figure out ways to increase the cost. And that's one of the strong hesitancies I have about this bill. Is there anything in the bill that would help people who don't have insurance pay for the prescription drugs that they need? And again, my concern is the price is going to go up 2, 3, 4 times over a period of time. And therefore, those who don't have access to insurance are not going to be able to access it at a reasonable price. Comments, Representative Morrison?
Representative Morrison.
Thank you, Mr. Chair and Representative Gruenhagen. The Department of Commerce has reviewed this and has determined that this does not represent a new mandate. And you make a great case for making sure that people are not uninsured in our state.
Representative Gruenhagen.
Unfortunately, Obamacare has started to increase the uninsured rate again. Just the opposite of what they promised. And I really, you claim it's not a mandate, but yet you're mandating without co-pays to the insurance companies. It seems like a contradiction to me. So I've got a number of concerns about this bill, but I'll let other people ask questions. Thank you, Mr. Chairman.
Thank you. Representative Ackland.
Oh, thank you. Thank you, Mr. Chair. And my Zoom just kind of went blank on, I can't see you or myself, but I'll go ahead if you can hear me.
We can hear you.
Okay, thank you. Just circling back on Representative Heinzman's concern about giving the 12-month supply, and to address Ms. Whittier's problem that she ran into, it seemed to me that really the standard that I've seen in my practice has been that as a nurse, has been that the prescriptions were written for 3 months at a time and with 3 additional refills. So that would, that scenario would prevent a 12-month supply being given all at once, which might be wasted. At least it would only be a 3-month at a time. And to Ms. Whittier's problem, pharmacies would be open late or on evenings or on weekends. And so I just wondered why that scenario wouldn't be a better option for the bill rather than 12 months at once. And that was just my first question, if somebody wants to address that first.
Representative Morrison.
Thank you, Mr. Chair and Representative Ackland. The idea is to make sure that make it easy for people to have continuous access and coverage, their contraception, which improves health and decreases the rate of unintended pregnancy.
Representative Ackland.
Okay, thank you. And I just wanted to clarify, Representative Gruenhagen was touched on this a little bit, but when you say contraceptive services, I know some women do use abortion as a means of contraception. And I just want to make sure if that's very clear, that abortions are not covered under this, and maybe that's covered under a different law or something I'm not aware of. So I just wanted to make sure that I'm clear on that.
Any clarification, Representative Morrison?
Mr. Chair, Representative Ackland, this has nothing to do with abortion other than decreasing the rates of abortion.
Okay, so
I'm just looking at the bill as well. The definition of contraceptive is on 2.9, and it seems to be pretty clearly things intended to prevent unintended pregnancy and has no language related to abortion. Representative Ackland.
thank you for your clarification. That's all I have. Thank you.
Okay. Any additional member discussion? Okay, seeing none, any closing remarks? Oh, Representative Gruenhagen?
Oh, thank you, Mr. Chair. Yeah, just one other area on abortion. I guess I'd like to see an amendment on the bill clearly stating that no abortion services or any prescriptions dealing with abortifacients are covered under this plan, just to clarify, because I can see lawsuits being filed, some judge reading between the lines, and the next thing you know, it's covered. And so if Representative Moore would entertain an amendment in the future on this, I think it'd be a little bit more palatable in that area. Thank you.
Thank you, Representative Gruenhagen. We've had no such amendments submitted to the committee, so as Representative Morrison can consider it as this bill moves forward, I'm sure. Any additional member discussion? Okay, any closing remarks, Representative Morrison?
Thank you, Mr. Chair, and thank you, committee members, and thank you to the testifiers on both bills. I'm very grateful for their presence here today. And I urge support of this important measure to protect access to contraception in Minnesota. Thank you.
Thank you. And I guess I'll just, I think this does cover an important service, and, I'm glad to support this bill. It seems like it follows a pretty standard process, as far as covering contraceptive for 12 months. If there does happen to be a change, as you said, Dr. Morrison, it would be pretty unusual, but I think if it's done in consultation with a doctor, then it should definitely be covered. So thank you. With that, Ms. Somick, could you please take the roll?
Representative Freiberg.
Yes.
Representative Bierman.
Yes.
Representative Gruenhagen.
No.
Representative Acom.
Yes.
Representative Egbaje.
Yes.
Representative Ackland.
No.
Representative Carlson.
Yes.
Representative Franzen.
No.
Representative Heinzman.
No.
Representative Morrison.
Yes.
Representative Pryor.
Yes.
With 7 ayes and 4 nays, the motion prevails.
Okay. The bill has been referred to the Health, Finance, and Policy Committee. So thank you, Representative Morrison, for presenting your bills.